so gratified that LAMP agreed to partner with the Missouri Telehealth Network on this project.
LAMP stands for Language Access Metro Project, and we are an interpreting and translation agency under Catholic Family Services.
Hi, my name is Senka. I will be your interpreter for today.
Not speaking the same language can be a real barrier when it comes to medical care and health care.
We specialize in medical interpreting. That is the majority of our work. The LAMP provides interpreters on site, which is face-to-face. We also do telephonic interpreting, and we also provide video interpreting. The great thing about the video interpreting is that it's as if the interpreter were in the same room with the patient and the provider.
Everything about doing medical care or health care over telehealth is just like it is in person. The only difference is that we're using technology to bridge a distance.
Video conferencing, interpreting is great.
What we do when the patient comes, we just call them on telehealth. You just call the number. It's like dialing a telephone number. You just push a button that has their name under the directory and it calls them up, and I say, "Are you ready?" and they say yes. Then we introduce and then we just go. It's important because not all patients can travel for their health care.
When you have an interpreter that can see both the patient's body language and the physician's body language, it really helps gap the cultural chasm that's there.
I grew up in the United States. I came here when I was 12. For Bosnians, doctors are never direct. They don't really come out and tell you, okay, you have cancer. They normally in Bosnia go with the family. They talk with the family until they tell the patient. What if you're using a family member that's just not going to interpret that? That's just not going to say to their mother, "Oh, I'm sorry, you have cancer." Those are the sort of things that we at LAMP try to get the providers to realize.
You get all kinds of information by being able to see a patient, their facial expressions, their body language. It's just a dramatically improved quality of service delivery.
This can be a solution to a lot of the problems that we have with patient access to care.
Especially in the rural areas of Missouri, where maybe they'll have a Somali community living and working there, but they don't have a person who speaks English and Somali and who is a professionally trained medical interpreter. And so we help them get over that barrier in the fact that we have this pool of interpreters available to them.
Que se comuniquen con LAMP es algo...
Call LAMP. It is very important for us Hispanics to have someone that speaks our language, someone that understands us and knows our needs as Latin Americans living in the United States.
If your family member was getting a service, an interpreter, you want them to be the best they can be. You want an interpreter that's professional.
Even though they're using a neutral, unbiased third party in their medical interview, it's still an extra person in that room. All of our interpreters are required to go through HIPAA training. What is said in that room stays in that room. We take our patients' privacy very seriously.
Trained professional interpreters know how to conduct themselves in the room and at the bedside with the patient.
These all look okay.
It creates a huge liability for a medical provider in not using a professionally trained, unbiased, neutral third-party interpreter.
If more doctors and nurses and hospitals knew that this was available, I think more would take advantage of it.
The affordability now of the entire telemedicine system should really increase the use across the state.
Often hospitals and providers say that they don't have enough funding for professionally trained medical interpreters, but thanks to Missouri Foundation for Health, we were awarded this grant which allows the interpreters to be paid by grant funds. And so there is no cost to the healthcare providers in having these professionally trained medical interpreters at their disposal. It's a win-win situation. We're allowing those providers to adhere to Title VI and the class standards.
That's the way the Joint Commission works. They say you should do this, you ought to think about this, then they say you should, and then they say you shall. So in January of 2011, they're saying you should do these things. In January of 2012, they're saying we're gonna penalize you if you don't. If doctors use it, they really recognize how important and valuable it is.
There are 3 easy steps to request your interpreter. The first is to schedule the interpreter. You can call LAMP toll-free at 866-948-7133, or you can fax your interpreter request to 314-842-1303. Second is confirming the appointment. LAMP will call you and the patient 1 business day prior to the appointment to confirm. And the third is to get connected. Place the patient in the exam room, ensure the equipment is turned on, and dial our IP address. or you may look us up in the directory under STL-LAMP. For more information about free interpreting services, call 866-948-7133.